Welcome back, everybody. Captain Krista Stedman with Austin Travis County EMS here again, and now we are talking to clinical specialist Tyler Green, who is one of our communications clinical specialists. On top of that, he's also one of our UAS team members, and he is one of our recruiting ambassadors. So we're going to talk to Ty a little bit about our recruiting efforts and the things that we're hoping to accomplish. Ty, thanks for joining me.
Yeah, of course.
So tell me a little bit about what a recruiting ambassador does and kind of the recruiting push that we're doing right now.
Yeah, so our department's been probably about 30% short for last year. Our communication department's 42% short. So we're doing a big communication effort, not just here today, but everywhere in Texas. We went to Fort Hood, we went to Killeen, we go to Belton, we've gone to San Antonio, we're going to Houston, and we're just trying to find quality candidates to apply. So right now, anything, if you're just an EMT, you can apply, either for our field side or our communication side. That's our starting requirement right now.
Okay, so let's talk a little bit specific to communications, because there is a big need for recruiting in communications right now. So just give me a general overview of what does an Austin Travis County EMS communications medic do?
Right, so we're triaging all the calls as they're coming in. We're doing a lot of high-speed stuff up there right now, specifically with our C4 team that started. And so not every call needs an ambulance. And so we really honed in on our questions we're asking our callers, and that's getting triaged. These questions are kind of similar to the questions you get asked when you go to the hospital and you meet the charge at the intake. So they're going to ask you some questions. Depending on what you say is when you're going to go in. So we're doing the same thing, trying to find the most important, time-sensitive call first, to the least acuity call at the end. And so get the right resource to the patient at the right time.
Absolutely, and communications is also in charge of managing the overall system and dispatching units, is that right?
Right, we're dispatching all of Travis County. So not only do we just do our department, we're doing ESD2 in Pflugerville, we're doing Travis County Starflight, ESD1, 2 ambulances they have up there. So we're controlling all of the county, making sure the citizens of Austin and Travis County get an ambulance to their side.
And you mentioned Travis County Starflight. So within communications, there's a rank structure and there's also extra qualifications that you can get. So sort of walk us through the entry-level communications position and that one you can promote up to, and then let's talk about the aircraft communications as well.
So in communication, we have the same ranks as the field. So when you first get hired in, you'll be a communications medic. So the starting pay there is $22 an hour. And it's the same schedule that we all do. All you're doing is you're a call taker that triages the calls as they're coming in on the clinical side. And when you promote, you can promote up to a clinical specialist in communications. At that point, you're qualifying to be able to do the ACS position, which is a stipend position to be able to dispatch, talk to, facilitate the calls for the Starflight helicopter.
And another important part of the ACS position is just keeping track of that helicopter while they're in flight, right? Because it's a lot more dangerous for them in the air than it is for us on the ground.
Right, and we track their GPS coordinates continuously, but every 10 minutes we do a flight check status on them. Because not only are they responding to calls in Travis County, they're responding to calls statewide, depending on the needs. They are one of the only rescue helicopters in the state. Okay,
all right. So we'll switch gears just a little bit and go back to just talking about the communications specific positions. So we mentioned the communications clinical specialists, and we mentioned that they are eligible to train to the aircraft communication specialist position, but if they want to be a clinical specialist and may not necessarily want to deal with the aircraft side, what else does the clinical specialist in communications do?
Clinical specialist communications, they're able to go out into the field and do special event dispatching for ACL, South by Southwest, F1, at CODA, NASCAR. They also just manage the system as a whole at our communication center, just managing our 40 full-time ambulances and 7 demand units on every day.
And the positions in communications aren't just limited to communications medic and communications clinical specialists, right? There's a command position, there's QA, QI positions, there's captains. Talk a little bit more about the career ladder within communications.
Right, within the career ladder in communications, we do have our academy staff that train all our new hires. We do have a tech position. We have 2 of those. One is a command position and one is a captain position that manages all the technology in our department, from our cell phones to the MDCs and the ambulances. We also have our QA, QI. It's kind of like a designated medical officer, but for the communication side, that we can just make sure everybody's doing their job correctly, and if they need help, they can get some guidance.
So once again, the communications section at Austin Travis County EMS has lots of career opportunities just within that section. It's one of the many things that makes our department so great and so well-rounded. So thanks, Ty, for joining me to talk for a little bit, and we will be back later today with more.